Here we go, tubers and footers. This is my PSA, and I'm going to try and do this without getting way overexcited. So, every month, as a leukemia and a chronic pain patient survivor, I struggle with trying to get my monthly prescriptions refilled. And with the DEA and all the politicians forcing this opioid crisis upon us, the pharmacies have now had their hands tied and they are unable to fill these monthly prescriptions that I've gotten for years and other patients have gotten for years. I'm not the only one. So when they lump people who are using drugs to escape and they're getting them off the streets and things like that with actual cancer patients and those chronic pain patients who are using drugs to live and survive, there's no comparison. That is an absolute ignorance to put those two in the same box. They do not belong in the same box. Their motives and their desires for taking that medication are completely opposite. So why would you put them in the same space? I want to have a seat at this table. I want to be able to have this discussion with our politicians and the DEA and our pharmacies because this is out of control. I am doing everything in my will to survive. I get injections. I get all sorts of stuff on the regular. I will refuse to give up. I will never, ever give up. I want my life back. I worked so hard for my career. I worked so hard for my athletic careers. This is not how I planned on spending my life. This is not where I want to be in my life. And so to be treated like someone who's just wanting to check out is becoming absolutely annoying. And it's disturbing on every single level. And I want to be heard. I want my voice to be heard. This is not a solution, and there are solutions available. We should be smart about this. Let's do this right, politicians. Sit down with me, Dawn Young. Where are you, Lisa Murkowski? I've been reaching out to you guys. Where are you? Where are you, DEA? This is a discussion we need to have. People are committing suicide because they cannot live through the pain. That is not the same as someone wanting to check out. So how many people that are committing suicide that are pain and cancer patients are on your shoulders because of this so-called solution that you're rolling out, tying pharmacies' hands? It's not a solution.